I would like to invite Francesco Barbabella from the Italian National Institute of Health and Science on Aging, who will go through the details. I would like to take the opportunity to say, again, thank you, all the three of you, to say that the InnovAge project, as many projects, are based on the very passionate contributions of a core team. And Francesco certainly belongs to that. We have heard about Areti for Eurocarers, and I'd like to ask also Arianna Poli here to stand up just to say, because she has been also very supportive across the whole project from our team. And said that, I would like to give the floor to you, Francesco.
Before to start, may I ask the Mr. Chair how much time I have before lunch?
You were planning half an hour, right?
Yes.
Yes. Take the time. We might leave the discussion. Let's see how tired the audience is for after lunch, eventually.
Okay. Thank you very much. So thank you very much for your kind introduction. So I am Francesco Barbabella. I think almost half of the audience already had the chance to see me in email contacts and so on, because we worked with a lot of you for building up this InnovAge web platform that actually now is named InformCare, as Stacy kindly said this morning. And I'm here representing not my institute, the National Institute on Aging in Italy, but the whole research group which led the development process of the platform. So Giovanni mentioned some, there are so many others to mention, and of course many others that I will mention afterwards. So basically I will try to be strict to the point, so just some insights of how the platform was designed and developed, with some basic information on the consultation process that was behind and probably was not so much evident for some people involved. How the platform looks like, so I have some screenshots to show you, and which results we got from the pilot test we did last year in 3 countries, and finally some words about the implementation. So basically, just remembering, we are a small part of a bigger project called InnovAge. So our part is the work package 3 is up. It's about ICTs for informal carers. So our aim, the overall InnovAge project, is about social innovations for older people and healthy life expectancy. So our goal within the InnovAge project was to contribute to improving the quality of life of informal carers of older people in Europe by developing, implementing, and disseminating a European web platform. This means something that could be accessed in multilingual versions. Services, on one hand, information resources, and on the other hand, interactive services. The primary target group we wanted to address was the informal carers, of course, as this day is dedicated mainly to them, but of course we cannot forget about the secondary target group of care professionals, intended as any professional involved in dealing with informal carers, about integration of care, supporting them, so physicians, nurses, social workers, and so on. So everybody could be, every professional could fit this level. And on the other hand, employers of working carers. So how employers should address or start thinking of how addressing the issue of having at least 1/10 of their workforce involved in caring activities. So with the possibility that this person, this worker, have very hard problems in conciliating the two things. So about the design, we try to use a user-centered approach. So basically, basing all the design and development process on a consultation, on a wide consultation with users, end users, experts, and stakeholders. So far, we involved over 200 people in the whole process. And additionally, the 32 stakeholders, so the organizations which are involved in the implementation phase of the web platform, so at least one for each European country in the EU 27. So we had an external advisory board. We made surveys with almost 60 experts, users, and stakeholders for understanding which were the services to be implemented. We reviewed the most successful services in the field, finding out over 100 of initiatives in Europe and worldwide. We made, during the pilot test, some user tests, so preliminary tests with users for understanding if there were any problem in the design, in the layout, in the navigation patterns, and so on. And finally, we made a proper evaluation with over 120 carriers in 3 countries. So how the platform looks like. So briefly, this is actually the new INRCA's website. So it is online. I'm mentioning it just because the InformCare web platform is part of the INRCA's website. So in some weeks, you will find the web platform included, embedded in the website. So you see there will be a banner in the homepage, but also at the top right, you see in the main menu, InformCare section, which has in different languages a linking page with some description in 6 European languages and a list of all the services available for carers, for employers, for care professionals, for all the languages, for all the countries and the different languages in case a country has more than one. So Elizabeth showed some of the platform before. Now I'm going a bit more into detail. So this is basically the homepage. I'm taking just the UK version for simplicity. It's in English. So this is the homepage. So what the InformCare should expect to find there. So we have at top a main menu where the main sections of the platform are there. So the caring for the people, your own needs, support by the state, get help. These are parts of the information resources package. And the last one is the interactive services area. I will go in depth through all of them. So in the homepage, you find a slideshow that basically has some images and links to internal pages. So some running sections, so you can have an outlook of some relevant internal sections that might be of interest. On the right, you have a box on interactive services, and this means that for registered users, they will find the latest posts they will find in the social network, in the social, in the private social network. And below you find some other boxes that serve as links to other internal pages, and are quite different. So coping with caregiving, family and work reconciliation. So trying to navigate, caring for the people. So the first level, you are into a contextual area, so the caring for the people, so what I should expect. So everything that a carer should know about or should access for better caring, better take care of the older person. So we have we have a contextual menu on the left here. One item about impairments and care management, a list of most common impairments in older age, and symptoms and treatments and how to deal with them in daily life. Care and support services, what kind of services and in kind and benefits, I mean home care, institutional care, and so on, are available at the national level. Mobility services, transports, discounts, and so on. And home environment, how to arrange the home environment at best for making it safer and most comfortable for the older person. So going to the care and support services section, you have a sub-menu, and there are some additional items. As I mentioned, you can find information on home care, residential care, independent living, care services for people with ADL limitations, volunteer support services, and so on. So different kinds of services that we try to set as, I would not say standards, but something that you should find almost everywhere in Europe, to different extent, of course. But still, going to home care, for instance, in the UK version, you find some information and some external links that goes to other resources, external resources, in this case from Age UK, for reading more about the issue. Another case, if we just try to change the language, so at top you have this option, this feature that just allows you to change at any time the language of the platform. So you just switch from one version to the another in any page as you want, as you like, and you just choose the version you like. We developed so far 32 versions for 27 countries. In some cases, more than one version per country, like Belgium, like Luxembourg. And in one case, the UK version, we had both the UK for England, Northern Ireland, and Wales, and another separate one for Scotland, which we found an organization available to provide specific contents for just Scotland. But of course, this is flexible, so any other version could be even added and improved. So if we go to the Italian version, for instance, there are, the page looks a bit different, but basically it's the same content. So home care, here you find some tabs that basically allows you to have the same contents about home care in the same page, but actually to divide it in a more readable and easy to read way. So you just choose between home care or specialist at home, semi-residential care. So you just choose, and the content at the center changes. And at the right, we included some glossary. So if you want, if anybody who is in charge of the version could decide to include additional explanation about what some terms and words refer to, because might be technical, even if it is written in an easy way. There might be the need to use technical terms that might be explained. So I'm going through the other section, so your own needs. So this means basically the needs of the informal carer. And we see on the left the four main sub-areas: the coping with caregiving, how the person can cope with the situation. Then two main areas of reconciliation: work and family. And finally, some inputs and recommendation about physical exercise, how to stay active, how to take care of your physical status. So as well, for example, the family reconciliation page, you find other items, sub-items, in this case, managing multiple commitments in the family, one household for all, how to combine everything, and so on. So it's what I wanted to share is that some of these contents are actually provided, currently provided through agreements by some organizations or websites in English language. So this is an example from provided by CARES UK. Other ones are provided by organizations in Ireland, in Scotland, in the US. So very different countries, but that had good, reliable information that were translated into the different versions. So about the support by the state, here the main point is about the legal and financial issues related to informal caregiving. So basically, what kind of benefits can the caregiver and the care recipient receive by the state? But of course, what are the implications of changing the status of the older person if he has, for instance, he or she has some cognitive impairment, how to deal with it from a legal point of view. So this is basic information on national basis. About the last area, the Get Help, we found 3 main pages about emergency and contacts about emergency and crisis help, and other external references and resources about web-based good practices in the country, and a list of national organizations that are available for further support. So in this case, from the Maltese English version, there is a very long list of associations with contacts and of course the mission that the user could contact in case of need. Interactive services, the last main area. So you can access it everywhere in the platform from the bottom menu, the orange one, or at the home page also through the bottom, go to the interactive services. Here. Now, this is let's say the home page of the social network. So it works, as mentioned, like a bit like Facebook. So it is all internal. So only registered users can see what is happening. You can set all the privacy features according to your will. So you can choose everybody registered could see you, or you just close your network to those who you really know. So you have at the left your profile, so you can access and edit your information. At the center, all the posts published by your network members. At right, the newest members. So of course, I covered some sensible data and for privacy reasons of other users. And at the bottom, I don't know if you see it very well, but there are some mini chats, the possibility to chat with other users online, like in Facebook, basically. So we have the possibility of implementing a forum. This is the Italian version with some threads and discussions going on. So it works like a common forum, still only for registered users. Private messages that can be exchanged between the users or between the users and the staff who is managing the platform. Chat, working as an ordinary chat, so there is a space for displaying all the messages in the chat room, a place for writing down your message, and a place for seeing who is online and available to chat. There's additionally a video chat tool, and it works in the same way. So this area shows the posts, the text posts. Then you have the space for entering your text. You see who is online, And there is the feature here about activating your audio and video streaming so that the others can see or hearing you, and if the others accept, so the audio video communication can be established. Few words about the care professionals area and the employers area. These are only information resources, so only text is uploaded to the web platform. In this case, we have three main areas for the care professionals. So the area about your work in informal care, so raising the issue why informal care is important and relevant to be dealt with in your daily work. So the importance of informal care, how to recognize the informal care's needs in your activity, early detection, and the legal aspects. So what kind of information can be provided to the informal care, how to deal with the privacy issue of the older person, and so on. How to manage self-burden, because the even care professionals can be stressed and can be too demanded for their work. So what is the burnout? How to take care about care professionals' own health. And the last area is about resources. So some good suggestions and indication of external links and resources for obtaining more information and accessing other things that might be useful in daily practice. About employers, still some only information resources. We have only two sections here. One about your business and informal care. Again, why informal care, why you should deal with informal care in your business. So the issue of having benefits and giving benefits to both parts is really important in this respect. And some suggestions and practical strategies of how to support carers, both applying some legal framework at national level, but of course implementing some ad hoc strategies, so with ad hoc agreements with your workforce. We made our best also to make the platform available through mobile version. So it is done. So basically, when the platform will be public, the mobile version will be available as well. So you can check it with your smartphone, tablet, and so on. So it should work as well. Some words about the evaluation we did. So it was quite brief, around 3-4 months. In Italy, Germany, and Sweden, in last year, we involved around 122 carers. That's quite a lot for studies in this sector, actually. And we administrated some structured questionnaires and made some focus group with the users for understanding how it went. So I'm not going into detail of all this data, but actually the point I want to underline is that there was quite a significant difference between the samples in Italy, in Germany, and in Sweden that allows us to say very different things and try to draw some different conclusions from this experience. So in Italy, we had the majority of people were female, middle-aged women that had caring for children responsibility, so sandwich carers actually, and they had very low or medium-low actually educational level. In the case of Sweden, we had the majority of were spouses and partners of the older person, so quite older than the Italian sample, and had a very higher educational level. And this is reflected by the confidence with the internet of the three subsamples. So the Italian sample was not so confident with the internet, whereas in Germany and Sweden, the users were a bit more. Of course, these are not, cannot be generalized, these results. It's just a way to see how the platform can be received by different types of informal carers. So in this case, the Italian sample actually fit all the possible negative features. So to be a sandwich carer, to be a woman, to have a lower educational level, to have a lower digital internet skills, if compared to the Swedish and the German samples. So we had still 76% of the initial sample accessed at least once the platform. There were, I think, good numbers in days of visits and in time spent on the platform. Even in Italy, given these conditions, people over the 3 months were accessing the platform for, on average, for 3 hours. And I think it is quite a lot for considering the type of users we have dealt with. The most used interactive services were the social network and the forum, and to a certain extent the private messages. Chat and video chat not so well accepted, but most users preferred a passive use, so reading posts, reading news posted by others and by the moderators and so on. By the way, there was consensus in all the 3 countries that the platform was useful and adequate for, as constituting a safe place for them where to find reliable information. Global usability was quite good, but there were some technical problems, especially in the Swedish and in the Italian samples, for different reasons. In the Swedish samples, they had mostly some problems with the mobile version of the platform. So some things were not refined, so we had to, in the mobile version, in that time, so we had to deal in progress with them. But actually, for the Italian sample, there were most basic needs of support, technical support for just accessing and where to find some information and links and so on. So these were very different. Some quotes from the users. We got these from the focus group. So the most important things is that people feel this platform, they can use it whenever they want. They know that the other carers can understand and know what they are experiencing. They feel not lonely. And they like sitting down in their at home and chatting with someone, looking for tailored information that are for themselves at any time of day. And some of them felt they have understood that their experiences were worth something. Some of them declared to be less stressed because of other people posting that allow themselves to have flashing out all the negative feelings and to get some positive inputs in their own lives. The mutual learning and the possibility to be understood by other people, by trustworthy people, were major points of these results. So I'm concluding with a few slides about implementation. So what we have done so far: a web platform in 32 versions for 27 countries in 23 languages. That seems quite a lot. More than 2,500 web pages implemented so far. Less than 100, but I would say less than 50 are currently under refinements. So are basically just inserting the pictures in the menu pages and checking that all versions have all the contents and nothing is escaped from the uploading process. That was quite an extensive work. from your side, of course, but also from our side, from Areti and Ariana, especially for coordinating the whole network of organizations. There are over 300 web pages overall for both web care professionals and employers. And as I mentioned, uncountable number of contacts with each of you by the central staff. Potential. Well, as I mentioned, the platform is completely flexible, so we can add a new version whenever it is needed. So another language version for a already covered country is possible. Another version for another country like Croatia or Switzerland or anybody who wants to join is perfectly feasible. So we are open to any additional versions that wants to come. Adaptation and update contents can be done easily through an appropriate content management system. Of course, the tailored services, I mentioned all the interactive services that can be implemented, but actually each organization and version can decide which services to implement, because it's not compulsory to have all of them or even one of them if the organization have no staff to dedicate and resources to for that. Of course, in most countries, I imagine a lot of Eastern European colleagues would agree, this could be a first information hub at national level in their own countries, but even for Italy, there are very few web-based services and information resources for these target groups. So this could be really a way to promote and raise the issue of informal care across the country to all the categories of users and stakeholders. And of course, we cannot avoid to mention that we established for the first time a very wide network of stakeholders on informal care in Europe. So that costed a lot, but actually you are all here today, and I think it's a great result from our perspective. So I'm ending just with a big thank you from both INRCA and Eurocares to all the users in first place and experts that supported us in the process, and especially to the stakeholders, to the organizations and the individual members that were committed to support and to implement with us this web platform, this InformCare web platform that we really think could be of benefit for all the parts involved, for you, for us, for the end users. So thank you very much indeed.